Welcome to the George Washington University Hospital. To begin, in the case of emergency, before or after your procedure, call 911. For all other concerns or questions, contact your surgeon or personal physician. Your orthopedic procedure may involve either your hip, knee, or any other part of the musculoskeletal system. This video will review what to expect before surgery. Here are some other people that may be involved in your care: your surgeon, anesthesiologist, nurses, therapists, case managers, pain management team, and other hospital staff. Your orthopedic surgery is a planned procedure. This means you have met with your family physician and your orthopedic surgeon on several occasions, and you work together to identify the right time to have your orthopedic surgery. There are some things to know and do before your procedure. First, if you smoke, we recommend you quit because smoking increases your risk of complications, and the George Washington University Hospital is a non-smoking campus. Before your procedure, select a coach or caregiver who will be available to assist you getting to the hospital on the day of your procedure and be available to help you with your recovery after you return home. Your coach can be a spouse, relative, or friend. You should watch these videos with your coach. The role of your coach is to become educated in the rehabilitation process, provide you with whatever assistance they can after you are discharged, and to motivate you during your recovery. You should prepare for your return home prior to surgery by doing any necessary housework and meal preparation. Here is a list of what you will need when you are in the hospital. Name and phone number of your doctor and list of medications. Personal toiletries. Eyeglasses, not contact lenses. Telephone numbers of people you may want to call after your procedure. A small amount of money for newspapers or the gift cart. Books or magazines. Dentures if you normally use them. Credit cards, and comfortable clothing. Be sure to bring comfortable clothes to go home in, including undergarments and socks, loose-fitting pants and pullover shirts. If you have had knee replacement surgery, shorts that are loose enough to fit over a bulky bandage are recommended. If you have had hip replacement surgery, you should bring loose-fitting pants or shorts that will fit over a bulky bandage on the hip. If you have had surgery on your shoulder, bring a loose-fitting button-down shirt that will fit over your brace. You'll also need a pair of comfortable walking shoes, something flat with a non-skid sole, like sneakers would work best. Slippers and shoes with no back should be avoided. Here are some things that you should not bring to the hospital: your own crutches or walker, medications, large amounts of money, valuable items, and jewelry. Remember to wash with antiseptic soap the night before and the morning of your surgery. Here are some other do's and don'ts. Don't drink alcohol the night before or the day of your surgery. Don't smoke the night before or the day of your procedure. Don't eat or drink anything by mouth after midnight the day before your surgery. That includes water, food, other liquids, tobacco, cigarettes, gum, mints, and hard candy. You may brush your teeth, but don't swallow any water or toothpaste. If your surgeon instructs you to take medication, you may do so with small sips of water. Telephone numbers and directions to the hospital are available on our website at www.gwhospital.com. You will also find information on our parking locations and fees. The George Washington University Hospital looks forward to caring for you.